want to thank PK for inviting me. And if you want to leave today after learning about vascular surgery and endovascular therapy, this is probably the most important talk you will go through. So President Obama signed Affordable Care Act and Patient Protection Act, which I actually thought should have been Doctor Protection Act, in March 23rd in 2010, and then it turned into a law in 2012. The reason for this was 43 million Americans were uninsured, and they wanted to create a marketplace. However, they were worried about escalating cost, which is actually making Medicare really bankrupt. And this is because of incoming cardiovascular, orthopedic, and eye procedures. And other thing what they noticed was Medicare fraud. So they wanted to recover $20 billion in health care fraud. And here was Dr. Obama going to tell you all about this. Under fund flare, this act was signed, and the best part was what patients got through it. Healthcare insurance, elimination of pre-existing condition, and transparency. That means online access to doctors' data, hospital data, finance, and performance. But what did physicians get? Physicians got bundled payments, outcome-based medicine care, rewards, and penalties. Physicians also got more scrutiny, RAC and Medicare audits. We got ACO, which is Accountable Care Organization, moving to MECRA, which I'll talk more in details. Tremendous exposure to the world, performance transparency, CMS payments, and Sunshine Act, which shows our relationship with the drug and device companies. And at the end, higher taxes, because we fall into a tax bracket, which puts us to pay more money for uninsured. Then, if I ask Chris, does he know any of these terms, VPB, MIP? I'm sure he does not, because these are the brochures left on his desk, or our desk, by our office managers, which we never look at, and I'll discuss more in details. And if you forget about these terms, you can go to hhs.gov, because it'll tell you changes are ahead. So let's look at number one change is payment model. Fee-for-service model is now removed completely and is replaced by fee-for-performance. The payments to physicians are linked with quality of health care, quality and efficiency incentives, and coordinated care, which doesn't really fit very well in private practice. Payments are also reduced. Individual quotes are no more. Bundle quotes are placed as an example of this, which shows basically revascularization of FEMPOP segment, percutaneous or open, with or without stent. Everything is included in one bundle to tell you they're going to pay you less. It doesn't include in time, number of stents, and complexity of procedures such as PK did this morning. CMS encourages freestanding labs because they're far more easy to control, and all they have to do is give them one payment. Once freestanding labs are established, they're going to come down and cut the cost as they have done for us. Accountable Care Organization is number 2 development in the field, and this is a conglomeration of hospital, physician, pharmacy, private physicians, everybody grouped together to serve 5,000 Medicare patients. And if they show, in the last slide, cost saving, better outcome, meaningful use, preventative care, reduced readmissions, they'll get 1% of incentive money, and I'll show it to you how it works. However, by the time we realize the rule of ACO, we are moving to MECRA, which is Medicare Access and CHIP Reauthorization Act of 2015, where there's a number 1 term, which I mentioned, MIP, which is merit-based incentive payment. They're going to compare you with other physicians and figure out if your outcomes are lower, they're going to cut it down. Alternative payment models, if you're not going to be a part of ACO, they will figure out the amount of money they want to pay you. But then, on top of that, there's a physician quality reporting, electronic medical record, and Medicare shared saving program, and let me show you how they work. Let's look at CMS data. CMS revenue sharing must meet these following measures. If you're unsuccessful in dealing with these things, you're not going to get that money. And let's look at narrative specification of all 33 measures. So here is the top. If you can read it, top 5 have nothing to do with the patient care. It's basically getting to the care, and do you smile when you talk to your patient? It doesn't need to do anything with your treatment or care of these patients. So how did ACO perform last year? Fewer than 30% of ACO saved enough to earn bonuses in 2014. Very impressive model. We tried this model, it doesn't work. What happened? 97 of 353 medical ACA model earned bonuses. 5 pioneer ACO posted losses, 3 of which will owe $9 million to Medicare, 89 of MSSP, which is Medical Shared Program cost compared to their benchmark, but they were below what Medicare required. So although they won't be penalized, however, they won't get any money. That means they don't get money, physicians don't get money. Next in the line is transparency, which physician payment, performance, and comparison, hospital performance, and this data is very easily available on cms.gov with a click. So let's look at one of the physician friend of mine. I tried to check on him. I didn't want to tell you the name. You go there and look at his data, which is posted on CMS with a click of mouse, and he failed 4 places: getting timely care, health promotion, between the visit communication, and patients were not very happy the way he did not control the cost. Let's look at a hospital, Hattiesburg, where I work. Here's the Hattiesburg Hospital. This is how they tell you. And here is 30 minutes or more wait in the emergency room for a broken bone. They get 3 stars. Now the patients are going to think this hospital is really, 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 really bad. Sunshine Act is more transparency. This tells our relationship with the drug and device companies. People like PK, myself, who are involved in teaching and get grants from these companies. These are all going to be on a website. We are completely exposed. And this guy actually had a program on HBO trying to tell how bad these relationships are. So let's look at it. How do you find this payment? If you're a simple patient, let's go ahead and click on this search and explore tool, put my name in there, and there you are, nearly every Vinery Kumar you can find in the United States. Click on the top one, that's not me. Look and see, $10.81. It's kind of disgusting that somebody will think that we use their product just because they give us $10 meal. I'm sure we all eat meals every day. But things have gone even worse. There is a website called dollarsfordoc.com, which go tremendously in details to find out how much our relationship are. $3.49 billion given to 684,000 positions by 1,134 companies. And as you can see, I'm already jealous of this lady who has made $42.9 million. I don't know how she did it. Can you object this? Yes, you can definitely object it, but it requires, you have to say within 45 days, you have to call the company, and then it requires 15 days to correct unless it's going to stay on the website forever. This may go a little over, Mike, because this is a very tough subject. Next is Medicare audits. Those who don't believe that Medicare can come to your office, the new rule recommend that they have what is recovery audit contractors now. They get 20% of recovery from Medicare and Medicaid, and these Medicare audits can also be done by Medicare people. If they pay you more than $249,000, they can come to your office and ask for 49 charts, and that is delivered to electronic health record. You have no say-so in there. And as you can see, by this time in 2014, they have collected $2 billion already in back payments. Although there were appeals in early days, which were all denied, but now the appeal number has gone up to 258,000. People have begin to figure it out how Medicare is dealing with us. And simple as poor coding, like place of service, which is A and B code, you can still be audited for that. And audit means they will hold your payment till dispute is cleared. This could be 6 months, a year, or whatever. Now let's talk about Medicare fraud. I just want to show you some of the clippings from newspaper. There's a doctor, cardiologist from Ocala. There's hospice to pay $10 million for overbilling. There is nursing home, which settles for $125 million. They're going even further. Physician get 9 years in jail and $3 million healthcare fraud. And this is a healthcare organization which ended up paying $118 million because really you don't have any protection when Medicare actually performs the RAC audit for you. Electronic medical record is new movement. Of course, new fellows and residents are getting trained in this, but for older people, it's kind of tough. They require proper documentation, emphasis on maintenance, that if you have a cyber attack in your institution or in your office, you're responsible. Medicare will come and cite you and charge you for all that. Medical board requirement has changed since ACA. They require every doctor to be board certified and maintains a certificate, which are requirements for American College of Surgeons and American Heart Association, American Board of Medicine. All of them require you to maintain the certificate, and they are very stringent qualification for that. If you miss the medical board requirement, you could be thrown out of ACA and possibly from the hospital, because this is the pressure coming from accountable care organizations. Introduction of ICD codes, which is supposed to be last year but did not happen. It's going to come down to 2010, which is going to be an absolute process, because you have to get a new person who is basically trained in ICD coding. And unless you have the ICD coder, all your claims are going to be denied, because if you put old ICD codes. Number 9, people who are coming out from fellowship and residency, they're now going to face a tough problem. Who's better off, an employed doctor or private practice? And the data shows most of the doctors are leaving private practice and joining the hospital. They're citing the reasons for 30%, 36% of physicians saying reimbursement issues. 23% gave overhead cost as a reason. But I think the most important thing is easy to deal with new healthcare rules when you are in hospital or under a contract. So I want to spend a second to see the people who are making decisions for our life, how much they know about it.
All I'm saying is let's take the example of something like diabetes, one of a disease that's skyrocketing, partly because of obesity, partly because it's not treated as effectively as it could be.
Listen to this part.
Right now, if a family care physician works with his or her patient to help them lose weight, modify diet, monitors whether they're taking their medications in a timely fashion, they might get reimbursed a pittance. But if that same diabetic ends up getting their foot amputated, that's $30,000, $40,000, $50,000. Immediately, the surgeon is reimbursed. Well, why not make sure that we're also reimbursing the care that prevents the amputation, right?
He got his facts wrong.
Let's take the example of something like diabetes, one of a disease
well, we can
that's
stop
skyrocketing.
this right now, but he got his facts wrong. No doctors make $30,000, $40,000, or $50,000 by doing amputations. So the point I'm trying to make here is people who are making the decisions for our healthcare has absolutely no idea what we do. So you are in for an avalanche which is coming down the pipe. When you look at MACRA and changes in healthcare, it's going to be extremely tough, and you have to maintain your compliance with Medicare. Thank you very much.